Hello, my name is Dr. Sagar Lonial from Emory University in Atlanta, and I'm here at the ASCO 2013 meeting in Chicago, and I'm going to talk about the randomized phase 2 trial combining elotuzumab with lenalidomide and low-dose dexamethasone. So the eligible patients for this trial were patients with early relapse, 1 to 3 prior lines of therapy, and they were all treated with lenalidomide standard dose, low-dose dexamethasone, 40 milligrams once a week, and they were randomized to receive either 10 mg per kg of elotuzumab or 20 mg per kg of elotuzumab. So it's really asking a dosing question for the new monoclonal antibody. The results of this trial that we presented at the meeting are really long-term follow-up and update on that randomized phase 2 portion. And what we showed at ASH last year was that the higher dose of elotuzumab appears to have a shorter duration of remission. It was about 18 months, which is what we reported at ASH last year, compared to not being reached for the 10 milligram per kilogram dose. What we show at this meeting now is that the median duration of remission has in fact been reached, and it's well over 2 years. And I think what the exciting parts about this data really are is that it demonstrates that the combination of ELO with len low-dose dexamethasone, whether you use the higher dose or the lower dose of elotuzumab, appears to be almost double the benefit in terms of duration of remission compared to lenalidomide and dexamethasone alone. The toxicities from this trial were really fairly typical for what you'd expect for len and dexamethasone. Some cytopenias, some steroid-related side effects. The main unique toxicity was infusion reactions, which were mitigated as we went through the trial by using pre-medications to minimize the risk of infusion reactions. So in conclusion, I think we're very excited that we may have the first monoclonal antibody in myeloma. There's a phase 3 trial ongoing now called ELOQUENT-1 and ELOQUENT-2 comparing len low-dose dexamethasone and ELO versus len low-dose dexamethasone alone. And in fact, our data suggests that the lower dose of elotuzumab may actually be superior to the higher dose. And in those phase 3 randomized trials, we used the lower dose of elotuzumab. So we took the data from our early experience and used that to help design the phase 3 trial. It's very exciting, and we're looking forward to having antibodies in the field of myeloma. Thank you.